What is PRP? It is platelet-rich plasma. I'm going to explain it the way I explain it to every single patient. Platelet-rich plasma is kind of like your own body's form of regenerative medicine. And so imagine when you're little, if you've seen our other YouTube videos, this is always the metaphor I use because it works for me. But when you skin your knee, the clear stuff that comes to the surface of that wound, that's your plasma. It has all of your growth factors in it, your healing mechanisms. And so in dermatology, we can use that to help your hair grow thicker when we inject it into the scalp. We microneedle it into your skin to help you stimulate lots of collagen production. We even inject it in your tear troughs to brighten up underneath there, to thicken that skin. PRP is my answer to everything. I love PRP.
We do love PRP, and we use a lot of PRP, and very specific PRP for cosmetic and skin rejuvenation. We use a certain type of separator tube that's going to remove all of the pro-inflammatory cells. So you hear PRP being used all over the place. It's used in orthopedics to kind of heal joint injuries or to delay getting maybe a knee replacement or a hip replacement, those kind of things. But different. They may want some inflammation through there. What we're using is PRP that's just specific for cosmetics and skin, which is a really important differentiator to know. Not all PRP is made the same. And so we're getting all that platelet-rich plasma in there that's got those growth factors. Those growth factors are going to stimulate new blood vessel formation, new collagen formation, obviously stimulate hair growth as well. You're healing yourself in the areas that you're aging, essentially. And because it's your plasma, it's your growth factors, it's what's best for you, and you can't react to it because it was yours to begin with. And so that's one of the nice things about platelet-rich plasma, is that I have a lot of folks who say they only want to do something that's very natural. And there's nothing more natural than the stuff that's already circulating through your body, already there to heal itself. What we're just doing is we're utilizing it, concentrating it down, and putting it in the areas that you need it the most. When you think about PRP, especially for like hair growth, it's not a one-time treatment. To get to see this, and I see benefit, androgenic alopecia, what we see, male pattern baldness, female pattern baldness, that's got the most literature behind it, but I actually use it in a lot of other alopecias as well. And so coming to see the dermatologist to evaluate your hair loss is an important thing, because absolutely not all hair loss is the same. Some things need medical interventions, different types of prescription medications, but a lot of times PRP is still part of that plan that we do for folks. But it's a series. So you're gonna come in every month for 3, then at 3 months typically, and then most folks are gonna do their maintenance at 2 or 3 times a year. But looking forward ahead, if you say, I wanna start that maintenance, I personally do PRP because I can look kind of genetically at the women in my family and know where my hair is headed. I do it once a quarter. That's kind of my maintenance for PRP in my scalp. The other place that you're going to see PRP, if you watch some of our other videos, I automatically package PRP with our more aggressive laser treatments as well, because it takes that healing time, and you see it used a great deal in wound care and in regenerative medicine for people who have non-healing ulcers, those kind of things too. Clearly, we're not creating non-healing ulcers when we do these more aggressive lasers, but by using platelet-rich plasma, I am decreasing that healing time by about 50%. It's great because it gets you back to your life a lot more quickly, and it just adds to the results that you're getting. So at the end of any of our more aggressive laser treatments, which you'll see Tori gets to do on me today, we're going to microneedle in that platelet-rich plasma to get those healing benefits. And so Tori can talk about what you're seeing on this video today.
So what you're gonna see today is what we call platinum PRP. It's one of our most popular treatments because you get to try everything that we do PRP for. So you get a scalp treatment, you get your under eyes treated, and you also get microneedling with the skin pin with PRP. So you heal much faster. So that is kind of I think it's a red carpet treatment because you get all 3 areas treated. And that is something that both Dr. Holman and I do very regularly, at least once a quarter, like we said. So maybe you just want your hair treated, and that's fine. But if you're somebody that wants everything treated, platinum PRP is definitely for you and what you should bank your bucks for today.
Right, so the dark circles under your eye, she talked about that tightening and brightening, but even folks who have genetically induced dark circles, I see that a lot in different ethnic skin types as well. This PRP under the eyes really helps in that area also. And she mentioned you're seeing this skin pin microneedling, which Tori and I love skin pin microneedling because it's collagen induction therapy. So essentially by creating these thousands of microchannels in the skin here, we're stimulating your own body's healing response for collagen and elastin production. There's really great scientific data. You can see the before and afters when you look at histology slides, the actual production of that collagen and elastin and the tightening that you see in your skin. And again, it's your own body's healing mechanism. So by adding the PRP to this microneedling, we're only upping the game. We're aerating the lawn with the skin pin, but the fertilizer that we're putting in there are her own growth factors, so that the response is going to be just even more dramatic. And especially like in post-inflammatory hyperpigmentation that folks have from acne scarring, that's where we see some very, very dramatic results with skin pin and PRP as well.